Good afternoon, good evening, joining us for the Africa CDC Mpox weekly briefing. My name is Margaret Edwin, the Director of Communications. I will be moderating this session. Today, our main speaker is Dr. Ngashi Ngongo, the Head of Incident Management Support, joining us from Burundi. I will now hand it over to Dr. Ngashi to start. Dr. Ngashi.
Director, good morning, good afternoon, good night to everyone, depending on which part of the world you are in. First of all, let me just start by presenting the apologies from the Director General, who is currently traveling and couldn't be to take the call. And also, let me thank again for making the time to meet you guys to get this update on the situation of Mpox on the following declaration of Mpox as a public health emergency of continental security in August last year. But just to say that this is also happening at the time we are dealing with Marburg. I think many of you might have heard the announcement by the head of state. Again, to reiterate that the number of public health events and outbreak is increasing every single year. We had 103 and we registered 214. That means that have become part of our daily work. We are very to get this update from us. And perhaps, I don't know if we can move into actual presentation. Thank you. Yeah, let me just by presenting the epidemiological situation of the year 2025. Notified cases of 842, of which 69 confirmed cases. I think the DRC data included. We are still waiting from the country as they were cleaning up the data. As soon as they submit to that, most likely for next week's press conference. We've had among all notified cases and among confirmed cases 4 deaths from Uganda. Now, as of now, of 21 AU member states that are being affected by Mpox, but recently we have about 10 member states that are actively the situation has remained almost dominated by Central Africa, which account for 88.7% of all and almost 90% of all deaths that have been reported. But when we look at the situation, we had confirmed cases 367 that came from the 3,100 suspected cases, and the number of deaths among all cases at 90. Next slide. Now, second week of 2025, I think there were 67 cases that we spoke about. That's Uganda, Burundi, Central African Republic, Nigeria, and Syria. I dare to say that we are still waiting for data from the DRC. As we reported already, registered its first case on 10th of January. The second epi week, I think they have now 12 confirmed cases. And the sequencing of the phase 2 cases to be. Across the continent, as I said, that are in active phase of the outbreak. But most importantly, if you remember that last time we mentioned that there were 8 countries that were in control phase. New countries that have also that Nigeria. And with that, we have reached now 11 countries that are in control phase and the 10 that remain in active case. And as we that the good news is that there are about 4 countries that have exceeded the 90 days with no those countries, which are South Africa, Gabon, Morocco, and Zimbabwe. Next. Now, when we look AP curves of category 1 countries, which is the highest risk countries, seeing some pattern when we put together the year week 1 of 2024 up to AP week 2 of 2025. We are seeing interesting pattern. There are countries like Burundi, certain level of stabilization. I think we see the plateau a couple of weeks. At the same time, there are also a set of countries that we see the upward trend. I think where we're still registering an increase. Now, the situation in the DRC, I think we try to zoom in into the hotspot as we are now thinking about the acceleration of the response over the last part of the, which is January and February. There are 3 provinces that account for 9 confirmed cases. I think those provinces are really the context of high population density. It's also where we have a problem of access to and also high travel provinces. Just to say that forward, I think there will be some intensification of the response that are the most affected to ensure that surveillance is strengthened, laboratory is disseminated, and that infection prevention is also scaled up. Vaccination is also accelerated so that we can really see toward the end of February, beginning of March, see some stabilization, if not the beginning of the conflict. Next. We, as in Burundi, where we are right now, just to say, and review in December, where we had an opportunity to take stock of some of the lessons that were part of the continental plan. What has succeeded, what has not succeeded, and how best we can really manage the second phase to accelerate the progress. Uganda, the 2 countries that did not conduct at the time because they were not ready. This week, we are privileged to be here in Gite, also with Her Excellency, the Minister of that's involved in interaction review. The same picture, we have about 7 districts in Burundi that account for 85% of all confirmed cases in the country. 3 districts are in Bujumbura, there where we have 57.8% of all cases, and also North Bujumbura, which is the most affected district among them. 0.2%. I think those are the acceleration of the response. Next. In Uganda, we also found a similar pattern, fewer districts that account for the vast majority of it's a seven districts in Uganda. I think that account for the vast majority of these cases. The judge to say that 3 of Nakasongola and Mbarara have the highest ranging from 13 of 100,000 population in Barara to 55. Next. That I just also spoke about, we have now reached about 12 districts. News is that Sierra Leone, learning from the challenges of the other countries on the listing and monitoring of contact is something that is really accelerated, with an average around 20 contacts per confirmed case, which is really expected. And of the 236 contacts are being monitored. On the suspected cases, I think out of the 82, 77 have been tested, and for those that is clade 2. Some challenges in the country, the most important one, which is the limited financing to support the Mpox response, but also the availability of reagent and test kits. And then the Mpox vaccine, I think it is not yet in the country. Now, on the laboratory testing, I think we are observing to say that at least for the second phase, very encouraging development that testing 90% and above, except in one single country, which is the DRC. I think that's why you saw last time DC handed over the laboratory equipment for the laboratory to the head of state. It was in response to the fact that not only DRC is the epicenter, but at the same time also DRC has testing coverage in the Mpox response. I think supported in that particular area to make round of result is short. People are not exposed for a long time with suspected cases while waiting for the result to be to return to be given, and the case management to be started. Next. I wanted to say before we finish that on the vaccination front, we do have now 4 countries that are vaccinating. Is Central Africa, Central launch also on the picture there. The Minister of Health administering himself. All the partners, WHO, UNICEF, the Red Cross, Gavi, are all supporting the rollout of the vaccine. I think they just started. I think they had more than 20 people that were at the launch. We are still waiting for the report to know now how far they have reached. In some 21 countries are affected, 11 that have entered in direction. As you also say that we still see in countries like Uganda, but the plateauing in countries like Burundi, which are some of the most affected, is also an element that giving us a lot of hope. I think there is also during this phase of intensification, I think the concentration in some of the cities like where we're seeing really the high numbers of priorities among the hotspots that have been identified for this phase of the acceleration. But it's also important to say that as we reported last time, that we had an integrated response. We had a country like DRC where we saw some of the other outbreaks that were concomitant with Mpox like measles. And now we are also seeing countries like Tanzania, and even here where we talking about the preparedness, for Marburg. And next week there'll be another team that will be moving also. Not only the interaction review, but also the preparedness leads us toward more integrated response that also address some of the common challenges important to address these emergencies that emerge. Just also Tanzania, on the 20th, declared the Marburg outbreak. What that there have been 10 cases that have been notified. 9 have already died, which really reflect the severity of Marburg. Now, so that you can then understand also the quality of the response in Rwanda, where we have this rate, around 22%. The team already ago that supported the Rwanda response. They are already in Tanzania right now, and we are doing everything we can with WHO and all the partners as possible, try to emulate some of the progress those experience. The teams are already on. The cases are mainly in the Kagera region. If you remember, the same region that also reported an outbreak of Marburg in 2023. It's a region that is Burundi, Rwanda, and Uganda. I think the level of preparedness is very high. In Burundi also, we've discussed that, and very soon to strengthen the surveillance, strengthens the laboratory, that the case also strengthened with centers that are identified, as well as the infection prevention and control. I think there have been 31 tests and 29, I think, that are negative. Now, the response has also been thought through. There's the National Response Plan of Tanzania has been developed with a budget estimated at $10.8 million, I think, to help the country. That will be focusing on strengthening the key pillars of the response around surveillance, around laboratory and community engagement, IPC, and case management. And the surveillance is already being stepped up, and they are already listed. Cases that I've just spoke about 200 contacts have been listed and are being followed. There to show that if you look at the average, it's about 28 contacts per case, which is very good. It really shows that this level of contact to control the chain of transmission. Next. And finally is on cholera, the situation of cholera in Angola. As you know, that they had a cholera outbreak on the 8th of January 2025. 108 cases that have been notified, of which 104 confirmed, 104 suspected. The case fatality is quite high, 4.5%. And there are 5 provinces that are affected: the province of Mambo, Ikole, Luanda, and Malanje. Of the people that are affected, I think females make 52%. And on the age group, I think half of them, they are affected below the age of 20 years. I think there are some challenges related to the heavy rains, I think with the risk, and also the delays in care seeking. I think those are some of the challenges, but we're already working with the government. Even identified cholera vaccines. I think that with the deployed to Angola next week. I think we are there working with the government of Angola very closely to make sure that this outbreak also gets under control. I think that's the this presentation. I would like to thank you for your attention. Back to you, Director.
Thank you, Dr. Ngashi. Questions from the chat room. The health editor of Conversation Africa. The question is, how far is the rollout of Mpox vaccines in Kinshasa? That's the first question. From German press agency asks, Marburg outbreak, how many more cases have been confirmed and what are the updates on contacts or countermeasures? You can take the first two, Dr. Ngashi. Over to you.
Yes, thank you very much, Director. On the vaccination in Kinshasa, we've seen some good. We had reported in December that we were at 55,000, and the last 4 weeks, most of the vaccination has taken. They have moved to 180,000 tested, vaccinated. That means that's about 125,000 more. I think that have been added. Right now, the government, they revised vaccination plan, and Kinshasa is one of the hotspots. I think that is also accelerated. The vaccination is already ongoing in Kinshasa. It continues, but only that the assessment found some weaknesses in terms of the target population and the approach, or especially like in Pakajuma area where there's really crowding and all those risk factors that are going. They're now revising the strategies to make crowded places where it is very difficult to single out the few contacts. They're going to vaccinate almost everyone in those high-risk locations. And also, they're going to make vaccination basis, I think, which was not regular. I think that's one of the reasons also they're moving much slowly. I think that strategy should be out. Hoping they were just crunching the numbers to also let us know what is the now new in terms of the number they would like to vaccinate, for us to help also look at the vaccine, if they'll be able to cover the population that they intend to. In Marburg, you remember when the declaration went out, it was based on confirmed, but since this morning, we got a report that I think that has been confirmed. That's how we spoke about 2 cases. And in terms of the medical countermeasures, we had the opportunity at the request of the government use, I think that was the vaccine, on more compassionate use. I think it is the same that is also being considered for Tanzania, but all that will be clarified once finalized, and they also requested the support that they need from Africa CDC and all the other partners to provide the same package in Rwanda. Over to you, Director.
Thank you, Dr. Ngashi. Let's take the next 2 questions. Kerry from Health Policy.
Thank you, Margaret. I just first wanted clarity on the stats. The 5 cases. And then my main question is, what is driving Mpox in Uganda? I remember the early report was that it had been identified in prisoners, then there was a mention. So I wondered whether you could just maybe spell out where it is groups in Uganda. Thank you very much.
Thank you. Let's take the next one before Dr. Ngashi comes in. That's Janice from Bloomberg. You have the floor.
Afternoon. Thanks again. I just wanted to ask for a response from Africa CDC. The news that President Trump is planning to withdraw from the WHO. And obviously, there are a lot of programs in Africa that have been funded by the US, PEPFAR being. I just looking for. Thank you.
Over to you, Dr. Ngashi.
Thank you very much, Director. I don't know, is Dr. Merawi, are you connected?
Yes, I'm here, Dr. Ngashi. Yeah, all right. Thank you very much, and good afternoon, good morning. Regarding the cases, that includes the DRC as well. The only thing that is remaining is confirmed cases that we are still waiting from the DRC. Yes, with regard to Uganda, the drivers mentioned since introduction into the country, that was followed by this truck drivers, and then it went into congregate settings. Then it is now the community. Some of the associated factors, including sex workers and so on, are main drivers now for the.
Yes, thank you very much, Dr. Merawi. Now, on the question about some of the decisions I think that have made by President Trump on WHO, on PEPFAR, I think that these decisions and to WHO, like Africa CDC, given the fact that we all know the US government, when it comes to the funding of in Africa, I say they are one of the main contributors of in Africa, PEPFAR, HIV that are very much on the American investment really to advance these programs. Now, the reduction or the cutting of that is going to affect the response in many of our. And of course, as one can also imagine, I think the same with WHO. We also know the role that WHO has played on the continent to provide the technical to the member state to really improve on the continent. Has to be discussed. I think all of us, the member state, will to get together quite fast and reflect on that and say, okay, what are the consequences of those decisions? And also think about some of the mitigation measures. Just to say that thinking, looking forward, that it is time for the African member states to rethink the financing of public health on the continent. That was already the push through the important role of domestic financing when it comes to the sustainability of these programs. I think that's exactly the point that we're getting. That Africa CDC has been pushing, I think, over the last two years, the establishment of this epidemic fund. But in addition, some of the innovative, there will be the meeting of the head of state, which is planned in Addis in February. But on the 14th, you've said that Africa CDC with President Kagame organizing an event on health financing. It was already anticipated made for this for the decision that have been made, but it also along the vision of Africa CDC, try to see how we can really push toward more sustainable, predictable financing of public health that come from domestic resources. I hope that as we move forward, these are the solutions that we need to rethink, and by this time, how we can accelerate them as if also resilience, on decisions like, so that all these programs do not just an alternative funding source that can step in and sustain this.
Thank you. Next two questions. Divex, you have the floor.
Communication from the around 25 Marburg, but that they tested negative. Can you clarify what that means? Are there some challenges, like the quality? Thank you.
Let's take the next one. Paul from the London.
Hi, thank you very much. I'd like to know what the situation is regarding the vaccination Mpox case count in Nigeria. On the question on financing, as far as the government is concerned, I'd like to know how Africa CDC is impacted, and what kinds of direct of support and financing that Africa CDC has on the US government. Thank you very much.
Thank you. Dr. Ngashi, over to you.
Yes, thank you very much, Sarah, for the question. 25 we got this morning is that they have run 31 tests. Of those 31 tests in total, I think 29 of them have been negative. There's only 2 that have been confirmed positive. It most likely, I think those 25 might be part of those that have been tested. We haven't yet whether all the 25 have been tested and confirmed negative. I think we just have to see. Take the 10 cases that were already there plus 25 perspective. That's about over 35 cases that we're talking about here. But up to now is only 31. Either they haven't been run, but they are not yet. We hope that once we get the full picture, we'll be able to come back to you. The question about the President Trump's decision and how that affects Africa. I would say that, at Africa CDC, there's one way that we look at public. We look at first what comes to us as an organization, Africa. And also what goes to the figures that we present there are not the figures for Africa CDC, are the figures for Africa CDC as well as member state. As I said, affect big time the member state for sure, but Africa CDC as an organization, not very much, because we are still, for the last 1 year, we are in the process of developing our joint with the US government, I think, to then bring together different US agencies would bring to Africa CDC. We're in the process of doing that. So funding from here that supports certain element of our work, but it's not the big funding for now. It's less than 10%. I think just to say that when you come to us, we don't really but what we can also be worried about is this current discussion of the new joint action plan, wanting much bigger support from the affected if this is ahead as it has been announced, that we might then need a little bit of expectation, the way they have been raised over that we've been discussing with the US government. Now, Gift, I don't know if you are there to answer the question on vaccination in Nigeria. Gift, are you connected?
I don't think.
Yeah, I think no. In general, Nigeria did not get that many cases. I think so to say, if of that they have applied. I think vaccinating around the case has also not required too many people. As we say, if you look at the average of up to 20 contacts that are expected from case, the numbers that they are reporting are for the sporadic nature, of the cases that Nigeria has been reporting. Suspected to be of zoonotic origin. Vaccination continues. As you know, Nigeria had received the first 10,000 doses, and then I think they don't have any problem with the doses. I think the only problem is the doses. They also have funds for the operational cost. I think that's what we know. But really, where we have most of the worries is that were allocated, but they haven't completed the process of receiving. And of the 3 countries that were vaccinating, Rwanda, it is more the DRC that had more challenges of having the vaccines that the performance on the ground was not reassuring that they can absorb the recent changes in the that's where we are. I wish more details on that question. Over to you.
Thank you. Let's take the next 2 questions from the chat group. So Christina O'Kelly asking, how many Mpox distributed across Africa and which countries? And then the second one, on a scale of 1 to 10, how would you rate the severity situation in Africa? Let's take the last one before you come in. Emmanuel from Japan Broadcasting of vaccination efforts against Mpox in affected regions and how distributed so far. Over to you.
Yes, thank you very much. I think the distributed so far are around 400,000 distributed in DRC, in Nigeria, Rwanda, now recently in Central African Republic, and in Uganda. The 5 countries that are vaccines, around 400,000 doses, 4 that have already are now vaccinated. Uganda, which is to start vaccines before yesterday. That's where we are now. This about the severity. I think the severity of Mpox on the continent affected by the double declaration of Africa CDC and which that just tells that it is severe enough, not only severe, but the impact of the spillover to other countries and also to the world that justified the double declaration by Africa and WHO. Stand now, just be a bit patient because the WHO advisory group will be the public health emergency of international concern. And the same thing will be also happening to on this Africa CDC communicated 2 days ago with the email to also rethink and also advise on what needs to be done. And most importantly, is at what point do we need to lift up the declaration of public health emergency? Or that is something they're working on it. I think in the next 1 week or so.
Thank you. Let's take So we have Kate Lay from The Guardian. He asks, clarify about the patients in Tanzania whose tests for Marburg have been negative. How negatives, or is the testing not reliable enough to say that with confidence? And then the next question is Janice of Bloomberg. Has Africa CDC seen willingness from other countries like China or the Asia in stepping up to fill the gap left by the US? Over to you, Dr. Ngashi.
Thank you very much, Director. Yeah, I think results are being conducted in the National Public Health Laboratory, Dar es Salaam, confirms that it is the highest laboratory. We trust the results. Tanzania is one of the countries that have capacity development, infrastructure, the upgrading of equipment and the distribution of I think it's one of the countries that has really been supported. The capacity in that country, we tend to believe the reliability of. Now, on the second question about if we are considering that they might step up to help us fill the gap. I think there have been really willingness over the past. You can see we've received support from many countries, from Korea, from China, from many other countries that have really come forward to also provide funding, either the cash to support the response. I think with the gaps, once we've taken stock of the situation and how that is going to affect us, I think we will be exploring the also broadening, I think, the resource mobilization toward those other countries that are really willing to step in. But let me just say something that at least for the US government has already had made on Mpox of funding 500 million response. If you saw our financial tracker, already dispersed around 314 million already in the Mpox through different channels. That says that the situation as it is now, it looks not bad, although we are just trying to. We also want the financial to identify how much, which country to support which pillar of the response. But overall, the response so far has been good. Now, moving into the future, if one door closes, natural to explore other doors to continue the response as it is. And especially another outbreak that is opening, we spoke about cholera. With all those, I think we'll have no option than continue exploring other well-intentioned countries that can come to the rescue of African member states.
Thank you. So this one asks a follow-up question on Mpox in Uganda. Are fishermen being affected? Measures being taken disease among neighboring countries, especially Kenya? That's the first one. And then the second one asks, what is the level of IPC intervention in epidemic in DRC, particularly?
Okay, thank you very much for those. I think, as you know, that the Kenyan case at the beginning, truck driver that moved from Uganda to Kenya. Kenya has point of entry surveillance, especially cross-border surveillance. Those are the measures, I think, among those that have been strengthened to improve the response. Uganda incident management support team would be involved in that. But the response that has been implemented so far from the Uganda side has really been a comprehensive response with laboratory in Uganda is almost 100%. With prevention and control, with risk communication and community engagement, and with case management. I think all those have been in place. The only element that was missing in the package, the Uganda side, was vaccination. Now they have received vaccines, and with the introduction of that, they have really a comprehensive package. Now, the interaction review will then look at, okay, what lessons can we learn? How can we do better, to make sure that, we have a much broader reach of these interventions to see the control of the epidemic that we are looking for. On the side, the same thing. Kenya has also mounted similar response because all the member states were aligned with the recommendations of the continental Mpox response plan. I think that outlined those key pillars of the response. The surveillance has been going on in Kenya, both entry, but also the community-based surveillance has also been going on. The laboratory in Kenya is also good. It's 100 in Kenya. The risk communication is also going on. The element that is left now for Kenya, like Uganda, that has moved fast is vaccination. As you know, Kenya has, and we have already received the feedback. It is just now that we are preparing for the deployment of those vaccines in Kenya. I think that's what IPC in the DRC. I don't know, Andy, if respond to that. You can come and use this one.
Yeah, thank you for the question. In fact, in the rural areas of the interaction review, it has been noticed that there is a number of challenges, including the level of training the healthcare workers, but also equipment. The WHO and Africa CDC is to address those challenges. Training, especially for Kinshasa, like the Pakaju, 50% of the cases in Kinshasa, we've been able to train and capacitate more than 100 healthcare workers. The community side, more than 45 community health workers and 30 leaders, community leaders. So it's really a complete capacity at the level of the knowledge, and then providing their course monitoring the practices at that level, both healthcare facilities and community level. Thank you.
Over to Director.
Thank you very much. Let's take the next two questions. Our science journalist asks, could you please update on the next steps in regards to the outbreak in Kagera region? So contact tracing and testing for in Kagera. So what is the next step there? And then the last question is coming from Majid from GIOPID radio. So what lessons were learned from the previous Marburg outbreak? And how is the Africa CDC supporting capacity building for local? Over to you.
Director, on the question about how we are responding. As I said, the first thing that we've done is to deploy a senior team. The same senior experts that were deployed in Rwanda within 20 to help Rwanda mount the response. We really want that experience of practices to also get the same people that were involved with Rwanda to go to Tanzania in the response. I think the lessons that, as I said, we now have a national response plan of Tanzania that captures and the role or to help them design the response. To that, as we did in Rwanda, we are also deploying a team of experts on the ground to support the response. In the team, we are epidemiologists that will support the surveillance pillar. We have laboratory specialists, even in the that are working on really the decentralization of the laboratory, with mobile laboratory. We have also IPC, infection prevention and control, and in communication, part of that implementation team. I think that is going to be deployed rapidly. Advanced team in really providing that technical assistance on the ground in the affected district for the response. To do three things. One, to look at the issue of knowledge. I think that's why we are talking about the training. To look at not the supply, the infection prevention and control for the case management, and also to practices, in the case management, in the hygiene practices and so on. I think that information is in the area of funding. I think what we are doing is to really coordinate with different partners how we can help the Tanzanian government funding in support of the 10 million plan with. I think that is something very important area of support is to get them the medical countermeasures. As I said, we are already in contact partners that support worked with us to support. Right now, they have already also approved the donation of the drug viral for treatment, also the donation of the vaccine. But now what we are working with the government is to then also make an official request for us to see how we can move. And just to say that really what we've learned is that we really need the leadership, the mobilized right from the start. That made the difference. You saw the way it was managed in Rwanda with the minister coming, on every press conference and also communicating on a regular basis where the needs are, how we can really adapt the support even to the progress in the response. That is something that is really critical. And there are also the coordination, I think, very key to make sure that there's complementarity among all the partners. The data, I think, which was critical because good data also tells the response is moving. And finally, the specific best practices, related to different areas of work. As you said, in Rwanda was amazing that at some point we are getting all the cases out of the contact list. Some assurance that we have the chain of control. They are the same that you can already see in Tanzania, how we have started in Tanzania. Look at the number of contacts, for an average of 20. Some of those best practices, we see them again coming out of Tanzania as well. I think that's the support that we are providing, and we'll keep on updating that support as the situation also evolves on the ground. Director.
With that, we have come to the end of our weekly press briefing. Dr. Ngashi for his last closing remarks. Over to you, Dr. Ngashi.
Yeah, thank you very much, all the participants, for this really to the work. And I'm talking here on behalf of the Continental Management Support Team that brings not only Africa CDC and all the partners that have decided to work together through this unified approach. A great motivation, ready to continue doing this work. And also these exchanges that we get with you, beyond just the questions that you're asking, are also an eye-opener on some of the areas that we need to provide. We are grateful for this and will continue on this. We are working together on the new situation on the Marburg situation that has come in. We are now supporting already countries just learning from the initial experience that we have now, Tanzania. We are just anticipating so that we don't get another country around the initial site that also develop Marburg. That's the reason why we have now teams that are positioned here in Rwanda this week, and then another team in Uganda next week. As Asia, that will continue really interacting with you, and we are going through very difficult time. There are many challenges I think that are coming our way, and we really we are open to also listen to you in terms of how much. Take you are a journalist. I think you also have an process to support these countries. I think your voice also adding to our voice, and also taking what we are reporting to you as the progress there to mobilize more support and more commitment to this response is something very much appreciated. With that, I would like to see you next week at the same time for our usual conference. Thank you very much to you too, Director.